all of you and extend gratitude to our very esteemed speakers. We have with us Ms. Inoshi Sharma, Director, Social and Behavioral Change Division, FSSAI. Ms. Micah Bruns, Lead Scientist, F&B and ISA Global from DSM. Ms. Purnima Menon, Senior Research Fellow International, Food Policy Research Institute. Ms. Sharika Yunus, Nutrition Specialist, World Food Program. And Mr. Rajesh Kumar Saheta, Senior Business Director, South Asia, DSM Nutritional Products. And all the stakeholders, senior government officials, industry stakeholders, etc., who have kindly joined this morning to be with us at this very important discussion on a very contextual and critical issue. And happy to share that FICCI has been continuously working in the area of nutrition and has been putting best of its efforts not only to drive the agenda of nutrition in the country, but also creating awareness amongst the stakeholders on different key aspects of nutrition like fortification, reformulation, etc. And considering the significance of this subject, we last year had set up an exclusive center for food nutrition excellence with a vision to strengthen food nutrition ecosystem. And it gives me immense pleasure to share that under the aegis of the Excellence Center, we shall be doing a 6-webinar series starting 8th of September on unlocking the future of nutrition with exclusive focus on the role of ingredients. And as you all know, this current week is being celebrated as the Nutrition Week, and FICCI will be supported. FICCI will, with the support of United Nations, the World Food Program, and DSM India, have come together to organize this much-needed interactive session on tackling the impact of COVID-19 on micronutrient nutrient deficiencies. We are all well aware about the critical importance of nutrition and diet in our lives, and COVID has really starkly brought it to focus. And we do believe a balanced nutrition is intricately linked to building the immunity and safeguarding us from severity of infections. And as the core focus of today's session is on micronutrients deficiencies, we will have a lot of discussion from the experts who are sitting here. So without further ado, I would like to invite our next speaker to share their views on rethinking evidence, building definition on role of micronutrients and may I invite Ms. Micah Bruns, lead scientist from DSM, to kindly make her remarks, please. So over to you.
Thank you. Yeah, thank you very much for inviting me today for this webinar. Great honor. I'm working as a scientist nutrition, a lead scientist public health for DSM. And DSM is a global purpose-led science-based company specialized in nutrition, health, and sustainable living. And DSM works in partnerships to tackle global hunger. If you go to my first slide,
Rajkumar, just put up the presentation, please.
I'm just uploading, ma'am.
Okay, in the meanwhile, I already start with my introduction because actually nowadays we know that COVID-19, the pandemic, is undermining nutrition across the world and particularly in low and middle income countries. And due to the COVID measures, such as trade restrictions, lockdowns, impact on food production and transportation, but also sales of nutritious, fresh and affordable food, we know that COVID has aggravated malnutrition, especially in mothers and children who are the most vulnerable. And malnutrition can also exacerbate the effects of COVID in mothers and children. And this alarming situation has led the 4 UN agencies you see highlighted in the logos below to come up with a joint call for action to protect the children and their right to nutrition in the COVID-19 pandemic. So they had formulated 5 urgent actions to protect children, their right to nutrition in the COVID-19 pandemic. And this publication has come out in July in The Lancet. And I will not go through it in detail, but it's just to highlight the call for action and the urgency right now. If you go to the next slide, this slide shows that micronutrients, they play a role in the development of the child. So they're important for pregnant women who are bearing children and also the growing up child. And they play a role in many functions of the organs, such as the bones, the skin, blood, lungs, brain, the nervous system, you name it. And many of the micronutrients are actually also essential for the development of functioning of the immune organs and immune cells. And adults need to consume them to maintain good functioning, but the expecting mothers and the growing children, they have elevated needs. They have higher needs than normal, and to meet the high demand for the growth and development of the child. Now, in the next slide, I will show you a little bit of science. Actually, if it's very difficult to explain the immune system, and I will try to keep it as simple as possible because it's so complex. But basically, there are 3 layers of immune defense. The first one, it's the physical barriers of your skin, of the lungs, of the digestive tract. So they're physical. They in diseased people or malnourished people, the barrier can become more leaky, and with as a result that pathogens can leak into the body, and that is then the first entry point of the infections. There is a second layer called the general immunity. This one is already present at birth. However, it's very non-specific. So this immune system attacks any pathogen that has entered your body. And by doing so, it causes a lot of side damage because it's not specific. It attacks all bacteria, viruses, and you name it. But then the immune system is learning. And when exposed to pathogens through childhood, the immune system becomes more specific and directed towards specific types of pathogens. And therefore, it becomes more efficient. This is called the specific or adaptive immunity. However, as we all know, viruses, bacteria, they change their appearance all the time. So even later in life, our immune system has to deal with new forms of pathogens and still has to learn from them. So we are better prepared the next time we are exposed to them. Corona is one of those new forms we're not yet prepared to. Then in the next slide, this slide shows that the immune nutrients play a very important role in the resistance to infections, but also for the recovery from infections. But they also play a role in the developing and the growth of the child. So in poor settings where the nutrient density of the diets is low, the intake of immune nutrients from the diet can also be very low and insufficient to support proper body stores of those immune nutrients. So immune nutrients, if they're very low, there's an increased risk for infections. And what you also see is in malnourished children, especially if they're deficient for protein, zinc, vitamin A, C, and D, they are at increased risk for infection, and you will see recurrent infections. And as a consequence of those infections, because infections use at an increasing rate those nutrients, the body becomes even further depleted, and they're utilized to fight against those infections. They're kind of trapped into a vicious cycle. And so actually the problem is that the body stores become more depleted, and this will be at the expense of the child growth and development. And what you often see is that recurrent infection result in in stunted children, too short for their age, but also a delay in development. Now, if you go to the next slide, because nutrients play such a key role in breaking this vicious cycle, it is very important that the nutrients are given in adequate amounts, but this is of course very challenging, and opportunities can be home fortification or fortification of staples, and they can contribute to breaking the vicious cycle. Vitamin A, D, and zinc have already substantial evidence behind it that they can reduce the risk for infections, but it makes sense to provide actually all the micronutrients that are essential for the development of the child and as well for the immunity of the child. Then in the next slide, I now switch to India. Actually, the slide shows that getting most of the essential vitamins and minerals from the diet is very challenging, particularly because nutrient-dense diets tend to be less affordable. And there's actually few data on the impact of COVID-19 on food consumption, and even less so on the vitamin and mineral intakes during COVID-19. But we can expect them to be less because of the food insecurity. And this was actually a unique study done during COVID times in India. It was a survey among vegetable farmers, and it illustrates that COVID-19 has reduced access to affordable nutrient-dense foods. In orange and red, you see the reporting of the households, and you see that the households reported to consume and purchase less of the expensive and perishable nutrient-dense foods, such as fruits, legumes, fish, eggs, dairy, and they were decreased at the cost of staples, the more cheaper and low nutrient-dense foods. So if you go to the next slide. Actually, this slide shows that the India state governments are reacting to COVID-19 with various measures, and they include also social measures, and they comprise, for instance, the supply of essential foods such as rice and wheat to the poorest of the households. They include community kitchens that provide food for the most needy, but also delivery of midday meals to school children whose schools are shut. And recently, the good news was that a new education policy has been put in place that mandates not only midday meals, but also breakfast for government schools. So those are all very important responses to COVID-19 to address the risk of malnutrition. And so actually delivery of food rations, so as the part of a safety net in the COVID-19 response, and fortifying rice and wheat could offer a unique opportunity to reach the most vulnerables with micronutrients that are in the fortified wheat and rice. And fortification as a complementary strategy to already existing nutrition strategies can improve the nutrition quality of the foods and provide a public health benefit as such. Fortification is recommended by the WHO, and it's one of the most cost-effective strategies to deliver micronutrients to the large groups of populations. And rice and wheat are main staples for 1.3 billion Indians, and acceptability of fortified staples is very high. And distribution through social safety nets, typically targeting population groups that can benefit most, such as school children or lower socioeconomic groups, offers an opportunity. And it was already highlighted, and therefore it could be a very good part of India's national nutritional strategy, food fortification is listed as one of the interventions to address anemia, vitamin A and iodine deficiencies, apart from supplementation strategies. And with that, I'd like to thank you for your attention. Maybe some key messages to take home before I forget. To recap, expecting women and growing children have elevated micronutrient needs. The needs for micronutrients during and after infections are even higher than normal. However, during COVID, access to nutrient-dense diets is compromised, and therefore fortification of commonly consumed staple foods can be an important strategy to increase nutrient intakes of the most vulnerable populations. Thank you.
Thank you so much, Ms. Bruns, for a very enlightening presentation on the role of micronutrients and the criticality, and how we should really be focusing on this in this very critical times. May I now invite Ms. Purnima Menon, a senior research fellow, International Food Policy Research Institute, to share insights on building better implementation research must support India's fortification efforts. That's the topic you're going to speak on. So over to you, Ms. Menon.
Thank you. I'm looking to share content. So if that doesn't work, maybe I think I need permission to share content here.
Yeah, sure. So,
okay, great.
Kumar, if you could, yeah, you got it?
Yeah, got
yes,
it.
ma'am.
Go ahead. Thank you.
Great. Thank you. Thank you so much to all of you for having me here today. I wanted to reflect a little bit on, why fortification efforts must be accompanied by implementation research, and how that's important, whether we're in the context of COVID or once we're hopefully, beyond the pandemic, but certainly through this process. The work that I'll share today and the perspectives that I'll share today have been informed by collaborations with many colleagues over the time, but especially in the context of COVID. I want to acknowledge collaboration with Divya Nair, Robert Johnston, Sunita Krishnan, several colleagues who've been working together on thinking about what are the kinds of things around which we need data in the context of COVID-19 itself. And I just want to bring sort of a fortification lens to that as well. So by now, we have been hearing a lot about the ways in which COVID-19 is likely to have impact on malnutrition in India. And it's very well recognized, both globally and I think in the context of India, that these impacts can be both direct and indirect, and that they're going to operate through multiple pathways. Not just that, the impacts will play out differently over the short, medium, and the long term, and the range of impacts that we see of the illness itself, whether it's the direct impacts or of all of the associated indirect impacts, are going to be very different for different subpopulations. What you see here is the pathways to impact between COVID-19 and malnutrition that we've been developing, with a group of colleagues and collaborators in India, and including Sharika as well, of course. And so I just want to point out that where fortification fits in the context of this is around indirect impacts, or mitigating potentially the indirect impacts as they relate to three parts of the impacts of the pandemic. Anticipated changes to the food supply chains, anticipated changes to education-linked programs, and changes to social protection programs. And of course, in a context where, it's likely that both food supplies and food prices would be affected, having available fortified commodities, et cetera, could be likely to, to contribute to improved diet quality, et cetera. But what I also want you to see when you look at these pathways is that as with all things nutrition, fortification or changes and issues we work on in the context of food are one of many pathways through which malnutrition is going to be affected. It, of course, is a very important pathway, and so really useful and important that we pay attention to it. Now, the reason that our research group, developed these pathways out is that we wanted to be able to look at it and say, what is the data that we need to prioritize, and keep an eye on as this unfolds. And in the short term, we prioritize looking at what's happening with food security and diets, what's happening with access and reach of food safety nets, and what's happening with the coverage and reach of, of health programs. And so there's, actually quite a collection of work happening on this. Now, you may look at this and say, what does this mean for fortification, and why am I bringing that in? Well, as I mentioned earlier, fortification links into some of these pathways, but not all of these pathways. As we've been articulating in the context of COVID more broadly, but I'm also going to put it out there in the context of fortification more specifically, that implementation research or data and evidence related to what is going on with program implementation, program quality, program uptake, consumption and adherence to what is put out either in programs or in the market, etc., is really central to knowing whether what we put in place. And this, today the conversation is about fortification as an intervention effort that's put into place. Tomorrow we may have the same conversation. Actually, in 2 weeks we're having the same conversation about many other aspects of nutrition programs. But data and evidence are really important to knowing whether what we put in place is reaching those who need it and is having an impact. And of course, this is done a lot in the context of food products, and companies are always watching what's actually happening in terms of consumption and other such things. But we don't often do that well enough in the context of public programs. And so, we're really sort of globally making a call for taking a very systematic approach to understanding and addressing barriers to effective and quality implementation of nutrition in context. And the context part is really important, even in the context of fortification. So, for example, in India, the context for fortification is both what happens in the foods that go into private market, but also very substantially what happens to foods and products that go into public programs. And I'll share an example of, a really nice piece of implementation research on that in a little while. And so in the context of where India is moving on fortification and really any of the nutrition efforts, why does implementation research matter? It matters because too many things can go wrong on the path from an innovation, such as the introduction of, say, a fortified product into a program at scale, to actually seeing that unfold and have an impact at scale. We should never assume that the program we put in place is going to have impact at scale. We really shouldn't, because we can't control everything along the pathway. And so without knowing that the innovation is moving along the pathway, we will really never know whether or not what we do is having an impact. And too many things can go wrong because there are many different contexts within which and through which intervention has to flow. So depending on what your object of implementation is, which could be, here in this case, we're talking about fortification, it has to move through implementing organizations in the context of frameworks that may or may not be enabling. It has to reach individuals and households, and there it's affected by their own context and needs, and it's affected by a range of implementation processes. And that is what, in the end, ultimately delivers an implementation outcome. And an implementation outcome could be coverage, it could be uptake, it could be consumption, a range of different things, right? So, and that in turn then finally has an impact on nutritional status. So, I think it's really important that we all think of this even in the context of fortification and say, well, what is it that's going to take us from the innovation here to impact there? Let's see. There are ways to look at implementation science and implementation the kinds of bodies of evidence that inform whether we are moving ahead on the right direction. And we sort of talk about three buckets of work. So contextual knowledge and experience, contextual implementation research, so sort of formal research processes, and of course, global knowledge and evidence. And I've been sort of involved in different conversations to date on fortification in India. And I'm going to say that the bulk of information or insight on fortification in India currently sits in buckets 1 and maybe bucket 3. There is very, very little formal implementation research on what's happening with efforts around fortification in India, and that's a problem. That's a problem that will come back, to affect the overall agenda and the overall approach in very different ways, because you will end up with a lot of contextual knowledge sitting institutionally, and sometimes being even lost institutionally unless it's actually codified and documented and put in place. I think it's amazing that we have entities like the FFRC to help to do that, and I'll come to that in my closing remarks. So I think I'm going to make an all-out call for strengthening bucket 2 here, which is contextual implementation research in the context of fortification, and especially if we're going to sort of engage in this in the context of of the pandemic, it becomes also very important there. So what does implementation research actually look like? It's a range of different. This is sort of more formal context, bucket 2 kind of implementation research. It's a range of different things, but typically it's done by independent researchers who work in collaboration with implementation entities, who could be, government program implementers, who could be, industry, could be NGOs, could be anyone who's putting in place these types of studies. And it can range all the way from formative research to process evaluations to costing studies, to doing creative routine monitoring. But the entire premise of it is that it is a partnership between the research community and the implementation community. Now, of course, there are challenges with doing implementation research, because the best place to do it is within and with programs that are implemented. It requires reconciling research objectives and values with program objectives and values. Very significantly, it does require adequate funding and funding platforms for research. And then for the researchers themselves, there are possibly issues related to funding and publication bias. And of course, we have to consider, what are the generalizable sort of insights from what are often very contextual pieces of research. So I want to show you an example, showcase an example of a very recent piece of work, which I think is a very promising example of implementation research in the context of fortification. So this is a study that is led by Shruti Siriak at Emory University, working with GAIN and others, looking at the double fortified salt program in UP, where double fortified salt has been integrated into the PDS. And what they do is they really look at the entire cascade of things that go from putting the program in place to what actually happens across this whole continuum among the client population. So broadly, it's a very, very long road from putting the program in place to the clients actually engaging with the program, using the fortified product once, to actually using it fully as intended. So for example, in this very nice cascade graph that they have in the paper, they show that, I think the program was sort of available universally in the areas that they were doing the study, but even there, just about 80% of people had ever heard of double fortified salt. But the actual adherence, but purchase was, say, in the 50s, 60 type of percentage levels, especially routine purchase. And finally, the adherence itself was really quite low. And what they do in their analysis and with their research is sort of unpack all the reasons why you had this faltering along the cascade. there are very, very few examples of implementation research like this in India. With 3IE, we've actually been doing an implementation research gap map, which will be released in a couple of weeks. And fortification is one of the least studied areas related to nutrition in India. And so, as I mentioned earlier, whether in the context of COVID or not, really thinking seriously about an implementation research agenda to accompany the fortification program work that's happening in India and that is expanding is going to be very, very important to helping us understand who it's working for and how it's moving. So let me actually close here, because I think, I don't want to belabor the point, but what's clear to me in having watched the fortification agenda unfold across India, and again, I'm just, really impressed with with the consolidation of information and the leadership of groups like FSSAI and the Food Fortification Resource Center. It's easy to know what is being done. But when I go and I click on the success stories, or I look for evidence on, well, what does the coverage of this look like? Who's actually using these products? How many people are reached? What proportion of the population has reached? And what do we know about the impact of all of this? There is very little of that actually available, and that's because very little research is being done on this in India. The research community needs to sort of really, step up and engage here. So while there are many opportunities to address micronutrient intakes via fortification, and I think we should be very clear about what we can do with fortification and what we can't do with fortification. We can improve micronutrient intakes. Whether and the extent to which that translates into outcomes, et cetera, does depend on a lot of other things. But in a context where so many programs and so many efforts are underway, we really need to invest in strengthening our understanding on how to know how well these efforts are working, who they're working for, and what affects both the implementation outcomes in terms of coverage, reach, uptake, and awareness, and of course, ultimately the impacts. Having an embedded implementation research agenda that sort of, cuts across these fortification efforts and is embedded in the different systems of delivery of fortified commodities that exist in India can really help to identify ways to strengthen these programs and to know what's working and what's not. Given the really tremendous gap in fortification-related implementation research, and I'll have some actual numbers for you, but I can tell you the number of studies is very, very, very low in the context of India. So really there is a huge need to focus and to build a body of research that cuts across the continuum from awareness to purchase to use, routine use, consumption, and impact. You need to understand this, and we may not need to understand everything everywhere. But to me, the DFS study in UP, for example, is very revealing. And when I go on the FFRC dashboard of the number of safety net programs that things like DFS are being integrated into, it makes me realize that, we need to know, how it's working in other contexts as well, so that, across the country, then you can start to consolidate insights across these different programs. So again, coming back to the context of COVID, I think it's, COVID or not, the integration of fortification into sort of a range of different public programs was starting to happen before that anyway. But, in the context of COVID and beyond, it's just going to be very important to know, all the ways in which this is unfolding and who's benefiting, who's not, et cetera. So, I'm going to make sort of an all-out call for, a strong engagement between the fortification community and the nutrition and food systems research community on, how well these programs are working. People like us would be more than happy to help support that agenda and the development of that agenda. But it's really, really important at this point in time as we see the number of programs starting to integrate these commodities. So let me leave you with that, and thank you again for this opportunity.
Thank you so much, Menon. I think you've really brought out the need to strengthen the entire ecosystem. Lots happening, but how do we interconnect and really make it, big and more visible? May I now, with these words, thank you, Ms. Menon, and invite Ms. Inashi Sharma, Director FSSAI, for sharing perspectives on future of staple food fortification in India from a policy lens. So over to you, Ms. Sharma.
Thank you so much, and it's great to be here. And it was wonderful what Ms. Purnima Menon just discussed about the need for research, because that is something at FFRC we are always, trying to get more and more information when we are meeting states or other stakeholders. Emphasizing the importance of why we should have fortification. So, of course, I'll be putting forward the regulations and the government's perspective that we've got on the fortification process. And because we've got a lot of, the industry, people from the industry who are here, during the course of my presentation, I would also like to emphasize the importance of how you can adopt the process of fortification as of now. So I'll just go through my presentation. So next, please. This is just an overview of, the food safety need of the hour. The amount of foodborne diseases that we have in our country is something that FSSAI is looking after. So the mandate is to ensure safety and hygiene. That is a part of it, where you ensure that the food is safe, it's hygienically prepared. When you are consuming it, it's absolutely safe to have. But does the food that you are having have all the adequate nutrients? Is it sufficient to have that food the way it is and be assured that you have all the micronutrients that you need to carry out? Now, that's not always possible, is it? So that's exactly what we are trying to focus here, that there are actually people who are falling ill, who do have deficiencies of micronutrients. Next, please. So the staples, just a second. So as of now, we've got 5 staples: salt, oil, milk, flour, and rice, which is being fortified. We are in the process of also passing a regulation for processed food. Now, because a lot of people from the industry are here, you would be delighted to know that very soon we would be coming out with a regulation whereby breakfast cereals, bakery products, buns, breads, biscuits, rusks, pasta, noodles, any of those commodities which are used by people for, say, cooking and all, and wheat or rice is the base in creating it, can also be fortified. Now, why are we talking about this is because on one side, it's important that the government push forward programs through the PDS or the MDM or the ICDS. The other is that the industry also, adopts these fortification programs and in their products add these fortificants, so that a lot of awareness is created among people about the health benefits of fortified products. Next, please. So the regulations are very simple. The amount of fortificant which is added, it is restricted to 30% to 50% of the RDA. So generally, if there is a concern that it may increase, or if people are consuming a lot of fortified products, it may lead to toxicity levels. All that has been taken care of. These regulations are passed only and only after a scientific panel has, gone through them. And way back on 2nd of August 2018, the FSSAI had got the regulations gazetted. So the transition time which we have given was till the 2019, and after that, what we have done is we are making sure that slowly the process of fortification becomes mandatory. Next, please. So the support that the government has been given to the fortification process has been way back from 1953. And subsequently, it has been going on through various innovative ways in the various 5-year plans. It has been pushed forward. This really is a recognition of the fact that just by ensuring, a proper healthy diet, while a lot of us can have all the micronutrients, we do know that a lot of people in this country are not able to have a balanced diet. And that's exactly the reason why it is important to push forward the fortification process of the 5 staples. Next, please. So as of now, the Ministry of Women and Child Development through their ICDS and SABLA programs is pushing forward rice, wheat flour, oil and double fortified salt. Within the MDM in the school program also rice, wheat and oil and DFS is being pushed. In the PDS, as of now, rice, wheat and fortified oil is being pushed. So there is a lot of market for fortified products, because whenever we reach out to a lot of states, many states have this concern that there are not too many people who are available when they come out with a tender and come forward to provide the wheat or oil or rice. So it would be great if the industry could adopt the process of fortification. Recently, in fact, the government in the MSME program of theirs have also come out with very simple loans and all for rice millers, for wheat millers, whereby they can establish milling in their milling plants. Simple, it's not very expensive, but now the government has said that very easy loans are available. So it's very easy to set up your plant, whereby you can mix the fortificant or the premix into the rice and the wheat flour or into the oil. Next, please. So what is the entire push here? I mean, how do you align the supply chain? So on the supply side, if we've got producers, distributors and food retailers who are fortifying their products and pushing it in the market. So it's not necessary that I have to get fortified rice or wheat from the PDS. It can easily be made available in the market also. And it's also many times aspirational. So if I am buying in the open market a fortified product and it is easily available, there are a lot of players in the market who are pushing these products into the market. Then when we are thinking of pushing it through the government safety net programs, for the government then to procure is easier. For the acceptance of people of a fortified product is also easier. So on the demand side, when you are creating a lot of consumer awareness, it's both ways. You create consumer awareness because it's not just about people who are getting rice or wheat in the PDS. It's about other people also. And I could be deficient in iron and I would never know about it unless I really become dizzy. Even then, what will I do? I'll probably go to a doctor, get a prescription and pop in pills. Now, everybody can't do that. The easiest way would be if we can just have fortified rice, wheat and our other staples. So we are at FFRC in a very concerted way in the next few months coming out with a strategy in which we will be pushing forward a lot of awareness among the consumers from our platform. In the meanwhile, we've already shared a lot of material with various states. So states which have picked up a lot of, they've already come out with their tenders and they've already pushed the program, have already collected the material from us. We've got it translated in the local language and soon this information will be disseminated. Next, please. So somebody just actually asked me a question that would it be for specific processed food as listed or would it be open to the entire processed food range? So as of now, when I've just listed the processed food range, it's just for the purpose of PPT. I mentioned a few things. It will be actually open for a lot of other products. The only condition that we have put for processed food is that they should not be HFSS, that means high in salt, fat, and sugar. If they do not fall into that category, all other processed foods can be fortified. So in this slide, what I'm trying to show is that we do, support private parties in the process of fortification by, providing our platform to even provide them visibility and do marketing of their products. For instance, if there are, you can see all these products which are placed here. We put them on our website, and what's really amazing is that when states are also going into the process of fortification in their states, they do look at our website and they do come to know about the various companies which are providing fortified products. So my request to all of you is, if you've got products which you are coming out in the market which are fortified, please do let us know. Please do send a snapshot of your product label from the front and the back of the pack, and then it would be something that we can put forward. Next, please. So this is our website. I would request all of you to visit it because we've got a lot of information here. How to get the +F endorsement, how to get yourself registered, what kind of IC material we already have available, which maybe you can adopt. If you've got IC material, maybe you could share it with us. What are the mandatory requirements for fortifying the products? What are the RDA requirements? All that information is available. Next, please. Next, please. So we are also in the process of supporting our labs, because what happens is that once a regulation has come out and you get the +F endorsement, we also do from time to time test products to make sure that the claims that they are making are true or not. So why I wanted to bring this slide at this point of time is so that I do share this information that we've got a lot of labs in our country which have facilities for micronutrient testing. Besides, we also provide a lot of information and training to these labs. We also have a premix and FRK suppliers SOP. So any industry which wants to set up a premix or an FOK supply chain, those SOPs are available for us. In case you are getting your fortificant or your premix from any of the premix suppliers, then you can also use these SOPs to ensure that the product that you are getting is of proper standard or not. Next, please. So we've got a lot of technical support. We've got handbooks available for all our fortified products. We've got FAQs. A lot of people might have questions regarding the 5 staples that we have. We've got a lot of information. So if any industry has a certain query about a product that they would like to fortify, please do let us know. We are always ready to answer your questions. Next, please. So because we are talking about COVID-19, I would like to just mention here that during these past 4-5 months, we have, through our COSTAC and other training programs, reached out to food handlers, and we've tried to provide information about how the safety of the workers and the consumers can be ensured. COVID-19 as of now does not get transmitted from food, but just the way food gets packed, and packed food also has a surface area is touched, and through that process COVID-19 can be transmitted. That kind of an information and sensitization we have been doing. So training and outreach activities have been going on. Next, please. So we've come out with this book called Eat Right During COVID-19, which I would request all of you to have a look, because it's just a simple guidance document for consumers of what kind of precautions you can take during this time. We've also come out with food hygiene and safety guidelines for businesses. So all business industry people, please do refer to this book, because this is a very simple guidance document about how you can ensure safety in your food business premises. Next, please. So what is our way ahead? The way ahead is that very shortly we would be coming out with the mandatory fortification of oil and milk. It's almost at the final stages. So after this, it would become mandatory for all milk and oil which is sold in the market to be fortified. We are also, as I mentioned, in the process of getting processed food fortified. So I would request all food businesses which are already here to maybe start your R&D or whatever process is needed for you to move to this stage. You can start it right now. We do provide training for staff on food fortification. Information is there. We do a lot of webinars on that. So you can always reach out to us if you want any information. Then we also do pre-mix quality checks, which I've already mentioned to you. Next, please. So at this stage, what I would like to really request the industry is that please do come forward and try to, bring out some of the 5 staples that we've talked about, some of these products in the open market under your brand name, promote fortification or the Plus F brand. Do come out with advertisements, creative advertisements, so that consumers become aware of the Plus F brand and fortified products, the benefits of it. We've got a lot of information. If there are any queries that you ever have, please do reach out to us. I see a lot of questions which have been put here, so maybe we can take them up at the Q&A level. So thank you so much.
Thank you so much, Ms. Sharma, for providing a very comprehensive policy layout which FSSAI is working on. And this is very impressive, and I'm sure more awareness that you are trying to create will help people understand the need for fortified food. For me personally, it's been very enlightening. Thank you with these words. May I now move to the next presentation, which is Advocating for Stable Food Fortification by Ms. Sharika Yunus. She's the nutrition specialist from the World Food Programme. So over to you, Ms. Yunus, please.
Good afternoon, everyone. I'll sort of delve straight into my presentation. Just give me a couple of moments while I try to share my screen.
Meanwhile, let me just, sorry to interrupt, but let me just ask everybody, if you have more questions, please keep putting them in the chat box. We can take it up after this presentation. Please go ahead, sorry.
Sure. Okay, let me just share the presentation, just 1 minute. Okay, so thank you so much to FICCI and DSM for partnering with World Food Programme so that we can have this discussion on food fortification. What I'll be talking a bit about is encompasses perhaps all the 3 PowerPoint presentations which have been made so far. I'll be talking a bit about the status of staple food for in India. Can you see the second slide? Is it now on the second slide, or perhaps?
Not yet, it's still on the first slide. Maybe you can just put it on the slide mode and then move
it. It is on the slide mode. Okay.
Now it's there. Yeah.
Sure. So we've talked about the problem from, as we heard from Inoshi ma'am in the previous presentation. So we know that the problem that we need to tackle is anemia and micronutrient deficiencies. We're also aware that there are known strategies to address the issue. So the known strategies are dietary diversification. There is supplementation, there's food fortification, and I'll come to that in a bit. There are various public health measures, insecticide treated bed nets, immunization, etc. And then there's nutrition health education. All these strategies have their pros and cons, and especially for countries like India, or perhaps for many countries in the African region or in the Southeast Asian region, with given our prevalences of anemia and micronutrient deficiencies, what we need is not just one strategy, but what we need is perhaps all of these strategies to come together and work. In India, we've had huge experience and good experience with iron folic acid supplementation. We do very well as far as some of the public health measures are concerned. We do have systematic approaches for nutrition health education. However, food fortification is an intervention that hasn't been tried, let's say, consistently or at scale, apart from perhaps some pilot efforts for the past many years. And it's only now in the past 4 or 5 years that we're seeing some momentum build up on food fortification. So we do need to bring in more solutions into the jigsaw puzzle that we have on how we can address micronutrient deficiencies. And food fortification is an important part of that jigsaw puzzle. Food fortification basically means to add vitamins and micronutrients into foods so as to improve the overall nutritional quality of the food, while at the same time being cognizant of the fact that it provides a public health benefit, but at minimal risk to health. The advantages of food fortification compared to perhaps some of the other strategies are that you can address multiple issues at one time. So you can look, if the more number of micronutrients that you use to fortify the food, the more number of micronutrient deficiencies you can address. It maintains the body stores of the nutrients more efficiently and effectively. It does not require any change in your food consumption patterns because it's a part of food and well, then there are no organoleptic changes at all, and therefore there is you can hardly make out the difference between unfortified food and fortified foods. And of course, it's cost effective as well. In India, like I said, over the past many years, there's been an enabling policy environment on food fortification which has come together. In the year 2006, we operationalized standards for fortifying foods, and the 5 foods that we agreed to fortify were oil, milk, rice, wheat flour, and double fortified salts. These standards were again gazetted. In August 2018. Like Enoshi ma'am has already alluded to, there continues to be enabling policy environment across different arms of the government, especially in terms of issuing guidance from the ministries which deal with some of the food-based safety nets in the country. And as most of you would know, as a part of the National Food Security Act, wherein food is an entitlement, the Act leverages on 3 food-based safety nets, and it ensures the provision of food grains to about 800 million of our population. Therefore, the food-based safety nets within themselves provide a good market or a good opportunity to integrate fortified foods. We've seen that there have been guidelines issued by the Ministry of Women and Child Development on the integration and mainstreaming of fortified foods. There have been guidelines issued by the Ministry of Education, the newly renamed Ministry of Education, earlier called the Ministry of Human Resource Development. And perhaps the most active policy step which has been taken so far has been in the formulation of the centrally sponsored scheme on fortified rice, which comes with a government funding close to 28 million US dollars. The scheme on fortified rice is to be rolled out in 15 districts across 15 states, and it has 5 very important components. Of course, one being fortification, then there's around capacity building, there's a component around information, education, communication, on quality assurance and control. And just alluding to Purnima's presentation, the scheme in itself has a very important component on monitoring and evaluation as well. And monitoring and evaluation, as Purnima said, we don't only need implementation research, but perhaps we need to monitor and evaluate all of these interventions and see where they're going, and then perhaps use the data that we have to also take corrective actions as we are on the journey of food fortification. Just coming to what is the status, given some of those enabling policy measures that we have taken place. And like Enoshi ma'am mentioned, on oil and milk and fortifying that, the country has been doing exceptionally well. What I have here for you is data dated January 2020, and I'm sure there's been more movement after that. The data has been shared from GAIN India. So there are many states in the country which are now providing fortified oil and for tune of about 75 lakh metric tons of fortified oil, and almost similar huge tonnages of milk are also being fortified and supplied. On double fortified salt as well, there's been huge momentum in the country. There are different states across the country who have integrated fortified salt in the food-based safety nets. There's also been a momentum of providing fortified salt through a market-based approach. And this market, as well as the availability of the fortified products, is only increasing as we move from one day to another. On rice fortification, again, there have been huge efforts by development partners such as Nutrition International, PATH, Tata Trust, and the World Food Programme. And now, because of the scheme, we will see fortified rice being rolled out across 15 districts in 15 states. And you have the names of the districts and states here. The scheme would be rolled out in partnership between the center and the state, wherein 75% of the cost of the scheme would be borne by the center and 25% would be borne by the states. However, this ratio of cost sharing changes when we move to northeastern states, where 10% of the cost of fortifying the rice would be borne by the center and only 10% by the states in the northeastern region. Slightly slow compared to the four commodities that I've talked about. Wheat flour fortification has also sort of seen momentum in different parts of the country. Let's say the momentum on wheat flour fortification was much more predating 2016. Post 2016, some of the other fortified staples have moved, or let's say marched ahead much more compared to fortified wheat flour. However, fortified wheat flour still continues to be provided through the food-based safety nets in various states, as well as in the open market. And it has a reach of about 82 million people across India through both the PDS as well as the open market channel. The source of this information is the Global Alliance for Improved Nutrition's office. This is one slide that I would perhaps want to dwell a bit more on. For food fortification to happen on a larger scale, it's important that the private sector as well as the public sector come together and work like cogs of a wheel. There's been a lot of policy environment, policy measures which have been taken by the policymakers and bureaucrats at the national level as well as at the state levels. And perhaps now it's time for the industry to also step forward and take responsibility of moving this agenda forward. However, from the policymakers, perhaps what we could expect a bit more is that some of the national level policy has been exemplary. It now needs to start translating into state level actions. And there needs to be an assured market in the social safety nets that needs to be provided to the private sector. Also, there is now a time where we've done many pilots, and most of the development partners have been helping with organizing pilots, and the pilots have been primarily done to demonstrate to the government as to how well fortified foods can be operationalized in government food-based safety nets. That's been the primary purpose of doing those pilots. And once it's been proven that it can be well operationalized, it's feasible, it's doable, I think now is the time that we start moving from these pilots to now mainstreaming it and moving beyond one or two districts in a state to a more mainstreamed approach wherein at least 50% of districts and states should now be providing fortified foods. We also need a more simplified regulatory environment, and FSSAI has taken many steps in that direction. However, there still continues to be confusions around GST, especially when I talk about it from the fortified rice perspective. So there are issues, and there are somehow two rates of the goods services tax which are floating around. We continue to have ad nauseum this debate between voluntary and mandatory, and it's very good to see that from FSSAI there is now a push to at least make fortification of oil and milk mandatory, and I'm sure the other commodities would also reach there. But mandatory in the larger scheme of things is the way to go. And that's how perhaps many other countries around the world have been able to achieve what they've been able to achieve on fortification. We need more innovative mechanisms for procurement of equipment. And here again, Inoshi ma'am mentioned about some of the schemes which are available from the Ministry of Food Processing and how those things can be taken forward. We do need there's an overarching need to have laboratories accredited who could be able to undertake analysis on the micronutrient content of fortified foods. So that's also an area of felt need. From the industry, the expectations that we have is now that the standards are out there, perhaps standards need to be adhered to, and the standards are already being enforced since July 2019. We look forward to having more quality assured products and a wider range of fortified products in the market. There's a need for consumer demand. The concept of what we are providing to markets is a value-added commodity. Value-added commodity also means that perhaps in some cases the price may slightly go up. But to make the consumer understand the value of the commodity, we do need consumer demand generation. We need the promotion of the concept of fortification and fortified foods. And this is not only a responsibility that the industry needs to undertake, but a responsibility that also needs to happen from the government side. And again, we heard from Inoshi ji as to some of the exemplary steps that are already being taken by the Food Safety Standards Authority of India. And again, we need competitive pricing. I do completely understand the need to up the market price compared to unfortified food, but the upping of the price needs to be reasonable so that the product also sells. I think with these issues, I'll perhaps stop here and we can move into the question and answer session along with the rest of the panelists. Thank you.
Thank you, Ms. Yunus, for highlighting the need for further strengthening the policy ecosystem to really actualize the entire vision around this aspect. We now move over to the Q&A session. There are already quite a few questions. So I'll just read, I think, first two questions, and between the panelists, kindly respond to these as you may deem fit. So the first question is, can fortification contribute to filling the nutrition gap? And I also, before reading the next question, must acknowledge we have participation not only from all across India, but I do see a lot of participants from outside India as well. I saw a gentleman from London as early as their hours for joining us. So thank you, Deepa, for being with us this morning to understand what's happening in this ecosystem in India. So sorry, I'll repeat the question again. Can fortification contribute to filling the nutrition gap? And the next question is, how does FSSAI supports laboratories in developing the capability for testing of fortified food? So of course, second question is on FSSAI. So if you could take that first, Ms. Sharma, and then we can generally talk about the fortification's contribution to nutrition.
So for labs, what we do is, one, we have a set protocol which we provide to the labs that their personnel need to be trained accordingly. So what happens is, many times what we've also seen in the field is labs usually, do get confused between cereals, right? But when you are checking it, you have to make sure that the dosage which is given for a particular cereal or a staple is matching or not. So for this, what we do is, time and again, we conduct these training sessions for the labs. So labs personnel are trained with information regarding how the staples have to be checked with the dosage level. That's one. And second, when these labs are also approved in terms of being able to do the testing for these staples, there are certain guidelines which they have to adhere to. Once they do that, then the labs are equipped to check. So that is what we do. The training process is regular. It's an ongoing process. Throughout the country, we keep doing it time and again. So it's not like we've done it once this year for a particular state. We keep doing it. It's an ongoing process.
All right, thank you. So anybody would like to answer the first question? How does it contribute to the nutrition gap fortification? Ms. Memin,
Jyoti,
would you
maybe
like
I could, yeah, sure, I could come in there. So, I think it's important to bring specificity to these questions. So, for example, when you fortify with a certain nutrient, we can only really affect the intakes of that nutrient and then the nutritional deficiency challenges related to that, right? So, for example, around iron fortification and anemia, there's been actually quite a few research papers in India that show, what is the potential contribution by fortifying staples with iron, etc., and then, what are the impacts on anemia. So, you have to really look at that specifically, and I think this is the kind of nutrient by nutrient and product by product evidence that could also be compiled and shared, if it's not already available, my apologies, on sites like the like the FFRC website, just so that even the India specific or within India state specific some information like that is available. But I know that in India, for example, especially work from St. John's Research Institute and Professor Sachdev and others, they've done quite a bit of work on the role of iron fortification and show that it can contribute, but the intent is never to close 100% of nutrient gaps from just a fortified staple, right? Because we want people to consume diverse diets. I think we're just trying to say, okay, by using things like fortification, can you get a little bit more in a context, especially where people's diets may be limited or where food commodities are particularly expensive around certain nutrients. So I think we also don't expect ever that fortification closes 100% of all nutrient gaps. It's going to be targeted, it's going to be specific. So I think it's important to ask the question with that specificity in mind as well, and look for the impacts there.
No, absolutely. I think there's no more awareness which is required. So I guess it's good to start with these and then perhaps let people know that they need to get into specificities. The other question is on how do we ensure that during COVID times, poor have adequate micronutrients? Of course, I think some talk has been there around the midday meals, etc. And of course, the role of consumer education in having the food fortification make an impact. So, Ms. Sharma, would you like to answer some of these or any other
So
panelists?
actually, for the first question that you asked regarding, the micronutrient availability to people during COVID, I don't think any of us at this forum would be really right to answer that. But I do know that the government has been making efforts, because see, what happens is when things are locked down, for instance, if your Anganwadis are closed down, or the MDM which is being provided to school children, if the schools are closed, it did bring a gap in between, when they were being provided with the meals. However, there are states where we have come to know that dry ration is being provided. That's of course one part. The other question, what was the second thing that you asked?
I said that role of consumer education. You did talk about that a bit in your
So
presentation
yes,
as well.
so you see, it's both ways. So one is, it's like the chicken and egg story. It's like consumers are made aware about the importance of products which are fortified, but it's not available in the market. The industry would say that we've got products, but not consumers are not buying. So it's both ways. You have to create the awareness among people, and you also have to make products and push it in the market. It's both ways. So what we are doing right now is we are creating a lot of material. We've translated it into most of the languages in the country. We've pushed it to all the states. You will see in a couple of months at the national level also, we will be coming out with campaigns about, maybe oil or milk, at least to start with, how people should have fortified milk and oil, and then maybe go on to the other staples. My request to the industry is that, we've had a very big webinar on the 17th of August with DOFPD, and almost more than about 900 rice millers had at least registered. And I think almost 500 had been there, about how, they should come out with products in which they are selling, plus F rice. Now, most of the products that you see are basmati. I mean, who will afford basmati? If you come out with rice, which maximum number of the people in the country are having, and maybe when you're fortifying it, the additional cost is only 1 or 2 rupees. Consumer does not mind paying it. But if you are already fortifying or coming out with a product which is in the top end or in a high range, I'm sure consumers would think twice. But it is something for the industry to take, to think about it. But yes, we are, pushing consumer awareness.
Any other panelists would like to take this? Ms. Yunus, Ms. Menon, anyone? Or we can move to the next. So the next question is, what are the micronutrients that are being emphasized now, especially in the pandemic times? So again, I think it's for the FSSAI, and next question also is for FSSAI. It's about the facilitation for implementing the research, and how do we connect researchers? I think the very point which Ms. Menon had raised. So would you like to respond to that?
Yes, so in fact, I am so glad that, Ms. Purnima Menon has made this presentation, because, let me be very honest, many times when we go to states, in some of the states, the first question that comes to us is, do you have any research which proves that if you are fortifying products or providing fortified staples to people, it actually improves their micronutrient deficiency or increases their levels? Does it help them? In fact, recently we did partner with PATH, and I think I did reach out to WFP, and we did reach to NI also to help us, in taking out a cost benefit analysis, that if I am fortifying rice and providing it to people, then what is the benefit that the government has in terms of, say, expenditure on health, or any of the other outcomes which would help us, say in terms of DALIs or any other thing. And I am so grateful, because we got so much of information. And again, we are pushing it forward to the government to say that, the investment which is being done in PDS is so minuscule with respect to the returns that we get. So it is something that we are constantly working on.
Thank you so much. So anyway, anything from Ms. Yunus to add from what's happening globally, or what are the, what can India learn from that? And maybe also from,
Sure.
Ms. Bruns as well, if you have anything to say. Go ahead.
Sure. I'll perhaps address the first question which you had, that what micronutrients are important from a COVID perspective, and then perhaps link it to fortified food, and then answer the second question that you had for me, if that's okay. So as far as COVID is concerned, and it's a fairly dynamic pandemic, and there is new research which is coming up every day. But some of the micronutrients which have come out important vis-a-vis COVID are zinc, vitamin C, vitamin D, and of course vitamin A. So these are the micronutrients which have come out as being important from a COVID perspective. Now, address as to what are the micronutrients which the fortified foods provide. Then for the fortified oil and milk provides vitamin A and D as per the law of the land in India. Double fortified salt provides iron as well. Fortified rice as well as fortified flour, it provides the standards stress on provision of 3 micronutrients mandatorily, and those 3 micronutrients are iron, folic acid, and vitamin B12. But for both rice as well as wheat flour, there are a list of voluntary micronutrients as well, which include zinc, which includes some of the B vitamins. That's the realm of vitamins that the different fortified foods provide. Over.
Thank you. I think next question again goes to the FSSAI. It's about the efforts being made for consumer awareness. And also, yeah, I think this is the question. The next is more on the production, etc. But anyway, if you have any data on production also, so they're asking if production use of fortified commodities has decreased or whatever has been the trend during the pandemic, if you have any trends available with you.
In fact, as such, I mean, okay, let me just give some background information also for this particular question. So when the lockdown happened, in fact, at FSSAI, we came out with immediate measures to relax imports. See, because a lot of activities had closed down. So we made sure that, you know, the imports of commodities, especially for premix, because that's a question that I saw, that did India experience shortage on premix or fortificant supplies? So what we did was we ensured that at least the import clearances are happening on time. We made sure that the import offices are open during the pandemic also. The global availability as such of the premix of the fortificant is something that I cannot comment on. But we did make sure that you know, there are no stages at which it gets restricted, so that the supply within the country is maintained. Now, because a lot of industry people are also available, you know, present here, I would request them to use their CSR funding in such ways that they adopt a certain program and try to create consumer awareness about you know, the plus F. The very logo of plus F is something, if people become aware of, is enough. I mean, you don't necessarily have to all the time talk about every health benefit. As long as the awareness is that if I am having plus F, I am getting a plus element in what I am purchasing, which is good for my health, is what is something that we are trying to now push. And like I've said before, that consumer awareness programs will be done by us. I mean, I don't know how to put it because it's so paradoxical, but one of the plus things which have happened with COVID-19 is this entire discussion which has started about food safety, hygiene, malnutrition and fortification. You know, this entire awareness about these topics, which was probably lacking before March, has suddenly, you know, today come to a place where people, the industry, you know, government officials, everybody is talking about. So I'm just so glad that these questions are coming up.
Thank you. But Ms. Bruns or you know, Ms. Yunus, anything you want to add, or Ms. Menon, if there is anything that you want to add to the questions that have been responded by the authority, but if you have anything to add from your experiences, otherwise we'll move to the next one. All right, thank you very much. I think these have been very good. Yeah. Sure, go ahead.
No, I was just saying that let's move to the next question.
No, the questions are done. I think these were the questions. We are done with the questions. Thank you so much. So we now move to the concluding remarks from Mr. Rajesh Kumar Sahita from DSM, who's the Senior Business Director, South Asia with that company. So over to you, Mr. Sahita.
Thank you, Ms. Wedge. I really appreciate the opportunity to speak with this esteemed panel. Firstly, I would like to thank Mike, Ms. Menon, Inoshi Madam, Ms. Yunus, and Ms. Jyoti Wedge yourself for this extremely engaging, educational, and enlightening session that is highlighting the need for staple food fortification to address nutritional challenges today. Just a way of introduction, I'm Raj Sahitya, and I manage the South Asia Human Nutrition and Health business at DSM. As most of you would be aware, DSM is a global purpose-led science-based company. We are active in nutrition, health, and sustainable living. DSM's purpose in itself is to create brighter lives for all. And living this purpose, DSM has been a global player in the fight against micronutrient deficiencies. And when I hear from all the panelists, be it micronutrients from Mike, need for micronutrients from Mike, the need for implementation research, the fact that public policy implementation and the government alignment is so critical, and how we, as Ms. Inoshi Madam actually highlighted, how the new policies are being developed with respect to that. how equally important is the involvement of the development sector? This all together is exactly what I would say is a need of the hour. It is very critical for us, even as a development partner or as a contributor to a manufacturer, while we work with organizations like UNICEF, WFP, state governments, and organizations, we need to provide access to the safe, healthy, and affordable nutrition solutions, which can optimize the nutritional levels of all the communities. Today, this pandemic has woken everyone up. This pandemic could actually result in one of the most worst, I would say, worst hunger crisis in history by impacting access to safe and nutritious food. This in turn could result in increased rates of malnutrition, stunting, and food wastage. It's even more critical to bring the right focus and investments to grow nutritional initiatives on a broader scale. Food fortification to increase these micronutrient levels in food is recognized as an effective, scalable, and a low-cost solution. I think the whole topic in itself was extremely relevant. I again want to thank all the panelists, Vicky for organizing this, and all the attendees, not only for spending time with us, but also for the valuable contribution through the Q&A, to the quality of the Q&A on a topic that is so relevant and required for today's challenging times. Stay safe and have a great day, guys.
Thank you, Mr. Hidya. It was really, I really thank you for, coming together with Vicky and putting together this very significant program. Very useful indeed. May I now move to our other partner from World Food Program, Ms. Eunice, to kindly offer the vote of thanks, and my thank you to you for joining hands with us in putting this together. So over to you, Ms. Eunice.
Sure. Thank you so much, Ms. Wedge. I think firstly and foremost, I'd like to thank all the attendees who've taken time out for this discussion, who've contributed with questions. And I hope that we've been able to answer all your questions, and perhaps there's something new on fortification that you may have learned. There's some takeaways that each one of you have before you move away from this webinar. Also like to thank all my fellow panelists, Ms. Jyoti Vich from FICCI, Mike Bruns from DSM, Purnima Menon from IFPRI, Inoshi ma'am, who's always who's always been such a rock solid support to all of us development partners, and who's also become one of the greatest proponents that we have in the government on food fortification. So thank you to her. A big thanks to Raj as well. I'd also perhaps just take a minute to thank the many people who've been working behind the scenes to get this webinar organized. Abhinav, Priyanka from FICCI, both of them from FICCI, Akanksha from DSM, and my colleague Surbi Dhawan from the World Food Program. So thank you so much.
Thank you so much, everyone, and thank you to the entire team, and thank you for being with us this morning.
Thank you. Thanks for having us. Yeah. Bye-bye.
Yeah. Bye. Bye.
Thank you.
We come to the end of the program. Bye-bye.
Thanks. Thank you. Bye-bye.
Thanks. Bye.